Because I used to carry a little Palm Pilot and then my phone and a beeper, and I look like Batman.
Yeah.
And now it's all down to one. And it's not only a phone; it's also, it's a PDA integrated phone. And if I don't put in there where I need to be at what time, I don't show up. So it keeps me on track on my schedule. And yeah, technologically, medicine included, everything's moving in a dimension of less paper, more electronics, and that ability, that technology is getting more mobile, if you will, and compact, so that there's no way to be inaccessible. The nice thing I like about it is that I have it on my phone, so I can carry it with me wherever I go. I could be at home, or I could be in one of the hospitals, and I'm able to access my schedule, some patient information that I might want to know, and I can better plan what I need to do in that particular part of the day or tomorrow. I found it very helpful sometimes over the weekend where I don't quite remember what my schedule was for Monday, and I'm trying to figure out if I need to be thinking about something in particular, and I just access my schedule that way, and I know who's coming, what they're coming for, and I think that has been a big help for me. It's accessibility to the information, whereas normally you would not have that. It doesn't tie you down to your office, and medicine's gotten to the point where you're doing more, seeing more patients, becoming busier to be able to do what you were doing many years ago. So being tied to the office limits the time you can do other things, and the ability to do work outside the office or access information that you need no matter where you're at, whether you're 100 miles away or just next door at the hospital, I think is helpful. That accessibility to information is key because it can be shared among physicians, and if you have a patient who you don't know and you're called about that patient, you can access their file and kind of know what's happened a little bit and give you a little bit of information that normally you wouldn't know, because otherwise it's stored in a paper file in the office and the office is closed. And so that, I think, is very helpful. I think it makes life a little easier for physicians. You can tailor it. Let's say you are a vascular surgeon, or you mainly just do or plastics is your primary specialty. You can filter out a lot of unnecessary things that you don't need, that you don't have to spend time looking for, and go straight to what pertains to you. And that can be that kind of customizing of the system. I think it's key, because if you can't do that, then it would be time consuming. But the fact that you can customize it that way and adapt it to your own practice, I think is key. And that flexibility is crucial to the system working well and smoothly. Everything's a code, an ICD-9 or CPT, and you may not always remember what those codes are. So you have a way of scanning the memory of the system and look for a particular procedure by name and then assign the code to it. Whereas before you say, well, I'm not sure exactly what that, well, never mind, and you may not code it. And this way you can at least either have, what I have is a set of favorites that I know I code a lot, and I have a set and that's mainly what I use. But then if I'm out of that realm and I'm not sure about a code, I can always go try and find. Well, it used to be that you'd get the information sheet from the patient and scribble on there the code, whatever you did, and all that, and give it to someone, and they would input something. And so there was multiple steps and pieces of paper you'd have stuffed in your pocket that could be easily lost, and I've misplaced my share of them. With the Prime Mobile, being able to pull up the patient, capture the charges right there and then when you've done them, so you don't forget them. All that information, patient name, age, what you did, codes, you know, the ICD-9, the CPT, all those codes. Put it in, send it, and it gets sent to whoever's going to do the billing automatically, pretty much. So it's already put in there. That's important because you want to make sure that you're credited for the work you do. And I know that once I click, you know, send, it's sent. And if it's in a piece of paper, it's in a piece of paper and it's not doing anything.